right, everyone, welcome back. Ready for another deep dive. This one is going to be all about AI and open data in healthcare.
Sounds fascinating.
Yeah, it is, especially with the Global Open Data and AI Summit coming up in London. Makes it clear this is a hot topic,
Absolutely. Definitely the future of healthcare.
It is, and, I was looking over that document on how AI and open data are being used, well, to improve patient outcomes, really, and make healthcare systems way more efficient. So what's got everyone so excited about all this?
Well, I think for me, it's really how AI is actually moving beyond just like theoretical potential, into real world applications.
Okay.
It's not just like, oh, this is what AI could do. Like we're actually seeing tangible improvements in patient care.
Wow.
Particularly in diagnostics and early disease detection.
So instead of just promising the moon, we're actually seeing AI deliver.
Yeah.
Especially in those early stages, catching a disease early.
Exactly. And the document highlights this really well. For example, how AI is being used to analyze medical images.
Sure.
Like mammograms. Yeah. And what's fascinating is AI can pick up on these subtle patterns that might be missed by the human eye.
Oh, wow.
There's a study cited in the document that showed AI actually exceeded the accuracy of radiologists in detecting early signs of breast cancer.
Oh, wow. Okay, so that's not just cool, that's potentially life-saving.
Right.
Earlier detection, often means less invasive treatment and a much better chance of recovery.
Absolutely.
It's like having an AI co-pilot kind of in the cockpit with you.
Yeah. Helping
doctors navigate those tricky early stages of diagnosis.
Yeah.
But it's not just about images, though, right?
Right. AI's ability to analyze complex data extends to genetic information as well.
Okay.
So imagine being able to predict an individual's, predisposition to certain diseases based on their genetic makeup. This opens up incredible possibilities for preventative care.
Oh, wow.
Potentially stopping diseases before they even take hold.
So that's what this whole personalized medicine thing is all about, right? Tailoring healthcare to each person, not just a one-size-fits-all approach.
Exactly.
Okay.
And AI is really like a key player in making that a reality. The document goes into how AI can analyze vast amounts of open data. We're talking demographics, medical histories, to even how individuals respond to different treatments.
Wow.
And this allows for the creation of highly personalized treatment plans.
Oh, wow. So instead of just getting the standard protocol, you're getting a treatment plan that's specifically designed for you.
Exactly.
Potentially minimizing side effects.
Yeah.
And making the treatment way more effective.
Yes, and it goes even deeper than that.
Yeah.
AI can actually analyze a patient's genetic profile to recommend specific drug therapies.
Wow.
Ensuring they receive the right medication at the right dosage right from the beginning. This can significantly improve treatment outcomes while reducing the risk of adverse reactions.
Okay. So it's not about AI replacing doctors. It's about AI giving superpowers.
Yeah, that's a great way to put it.
Helping them make more informed decisions and ultimately leading to better outcomes for patients.
That's exactly right. It's about collaboration, not replacement. And this personalized approach, it can have a ripple effect, leading to higher patient satisfaction, a better experience with the healthcare system overall.
Yeah, when you feel like you're being heard and your needs are met, it changes your whole experience.
Absolutely.
Okay, so we've got AI shaking things up in diagnostics, personalized treatment. But the document also talks about how AI is really kind of supercharging medical research.
Yeah.
So can you tell me more about that?
Sure, yeah. So open data, it's really a treasure trove of information for researchers. And AI it's like the key to unlock that treasure chest.
Okay.
We're talking massive data sets that AI can just sift through, identify patterns, uncover insights that would be impossible for humans to process on their own.
So it's like AI is giving researchers this turbocharged magnifying glass, letting them see things that they wouldn't be able to see otherwise.
Exactly. And this can lead to the identification of potential drug targets, predictions of how effective treatments might be, ultimately accelerating the entire drug development process.
Which means getting innovative therapies to patients faster.
Yeah.
Especially for diseases where treatment options are limited. Okay. That's really exciting. But the impact of AI, it goes beyond just the lab and the exam room. Right?
It does.
The document talks about how AI is being used to improve the day-to-day operations of healthcare systems as well.
Yeah, that's an important point. Often the administrative side of healthcare is overlooked, but AI can play a crucial role in, optimizing hospital workflows, managing appointments, predicting resource needs.
Yeah.
For example, AI can be used to forecast peak admission times, allowing hospitals to adjust staffing levels, leading to better efficiency and a smoother patient experience.
And that efficiency can make a world of difference.
Right.
Shorter wait times, less frustration, healthcare professionals who aren't drowning in paperwork.
Absolutely. It's a win-win.
It's a win-win situation.
By taking care of those repetitive, time-consuming tasks, AI frees up healthcare providers to focus on what matters, providing really compassionate, effective care to their patients.
Okay. So we've got AI kind of streamlining things behind the scenes, making the system more efficient and really improving the patient experience.
Yes.
But what about access to care? For people in remote or underserved areas, getting to a doctor can be a huge challenge.
That's a crucial point, and one that telemedicine is increasingly addressing.
Okay.
The document highlights how AI is being used to power remote patient monitoring and virtual consultations, essentially bringing healthcare beyond, the traditional doctor's office.
So we're talking about tools that can track vital signs, monitor medication adherence, and even provide real-time insights into a patient's health, all remotely.
Exactly.
Wow. That's game-changing.
It is. It's about making healthcare more accessible and convenient, meeting patients where they are, literally.
Yeah.
And AI is playing a key role in making that more sophisticated and effective.
It's like having a virtual health assistant, kind of keeping tabs on your well-being, providing guidance when you need it.
Yeah.
But with all this talk about AI's potential in healthcare, there's a big question that keeps coming up.
Yeah.
Data privacy.
Of course, you're absolutely right. And that's something we need to address head on.
Yeah.
We're dealing with incredibly sensitive information here.
Right.
Medical records, genetic data, even lifestyle choices. Ensuring that data is handled responsibly, securely, it's paramount.
So how do we strike that balance? How do we harness the power of AI and open data without compromising patient privacy?
Well, the document emphasizes the need for, robust data governance frameworks and the implementation of best practices for safeguarding patient information.
Well,
this includes techniques like anonymization, which remove identifying details from data sets. And strict access controls to limit who can see what information. It's about creating a system where data can be utilized for research and innovation, but, while still respecting the privacy and confidentiality of individuals.
So this is a conversation that needs to involve everybody, right?
Absolutely.
Policymakers, healthcare providers, tech developers, and most importantly, patients. People need to understand how their data is being used and have a say in how it's shared.
I completely agree. Transparency and informed consent are crucial.
Yeah.
Patients should be empowered to make decisions about their data and feel confident that their privacy is being protected.
So it's about building trust, really.
Exactly.
Trust in the system, trust in the technology, trust in the people who are handling all this information.
Exactly. Without trust, the full potential of AI in healthcare simply can't be realized.
Well, I think we've covered a lot in this first part of our deep dive. We've seen how AI is being used to improve diagnostics, personalize treatment, accelerate research, and even just optimize how healthcare systems work. It's clear that we're on the edge of a major transformation in healthcare, and AI is driving it. But as with any big shift, there are challenges to be addressed.
Definitely.
We'll get into those in the next part of our discussion.
Yeah, and we'll explore some of those ethical considerations, the potential challenges that come with integrating AI into this field that's so personal and so complex.
Right. So stay with us as we continue our exploration of this amazing landscape. We'll be back in a moment.
As we kind of dig deeper into the potential of AI in healthcare, you got to remember this is a field that's like constantly changing. What's super advanced today might be old news tomorrow, right?
Yeah, it's moving so fast. Like watching a time-lapse video of a flower blooming,
That's a great way to put it.
But this rapid change, it also raises some tricky questions, right?
It does, yeah. I mean, for example, as these AI algorithms get more and more sophisticated, you got to think about what happens when they start giving advice that's different from what the doctor thinks.
Yeah, that's a really interesting point. Like, imagine a scenario where the AI is recommending one treatment and the doctor's got a completely different opinion. Who makes the final call there?
Yeah, that's a tough one. No easy answers. It's going to take a lot of open communication, collaboration between the healthcare people and the people developing the AI. Figuring out how how to bring those AI insights into the decision-making process while still respecting the doctor's expertise
Right.
and the potential of the technology.
Like navigating a whole new kind of partnership, right?
Yeah.
Human expertise and AI insights working together.
Exactly.
But beyond the clinical stuff, there's also the impact on the healthcare workforce. I mean, some folks are worried AI is going to replace doctors and nurses altogether.
Right. And those concerns, they make sense. But the document, it seems to paint a different picture. The idea isn't to get rid of healthcare professionals. It's to kind of boost their abilities.
Okay, so it's more about collaboration, not competition.
Exactly. AI handling the repetitive stuff, the data-heavy tasks, freeing up the clinicians to focus on what they do best, that human touch.
Okay. So AI is like a supportive teammate, not trying to take anyone's job.
Exactly. And that makes a lot of sense. AI can analyze mountains of data, spot patterns we might miss, while us humans, we bring that empathy, that gut feeling and experience to the table.
Right, combining those strengths.
Exactly. To provide the best possible care. Imagine doctors having more time with their patients, really listening, understanding, while AI is handling the paperwork and offering those data insights to guide the treatment.
That sounds pretty great. But even with all these potential benefits, there's still that unknown factor. We're in uncharted territory here, and it's hard to predict exactly how AI is going to shape healthcare,
Absolutely. So many questions to answer, challenges to overcome, but that's what makes it so exciting, right?
Yeah, it really does.
We're on the cusp of a major transformation, and the possibilities they're really limitless.
That's like we've set sail on this vast ocean of discovery, and we don't know what we're going to find.
Yeah.
But the potential improving patient outcomes, I mean, that's what keeps us moving forward.
It is. And events like that Global Open Data and AI Summit, they're going to be crucial in navigating this whole journey. A chance to bring experts together, share knowledge, come up with solutions, chart a course for the future of AI in healthcare.
Speaking of the future, one thing that really stuck with me reading that document was the speed, This field is changing so fast.
It's true. The pace of innovation is crazy.
Yeah. And that brings up another point. How do we make sure these advances reach everyone, not just a select few,
That's a key question. We've talked about all the amazing stuff AI can do, but will everyone benefit? Or are we going to see that gap widen, between those who have access to this cutting-edge healthcare and those who don't?
That's a real concern.
Yeah, definitely something we need to be aware of. We've got to be proactive in addressing those potential disparities, making sure AI is used to create a more fair and accessible healthcare system, not make things worse.
So it's not just about developing the technology, it's about making sure it benefits everybody.
Absolutely.
It's about using AI to bridge that gap, not widen it.
Exactly. And that's going to take a real effort from everyone involved, governments, healthcare providers, tech companies, everyone. We got to work together to tackle those issues of affordability, digital literacy, making sure everyone has the chance to benefit from the transformative power of AI.
It's about a patient-centric system, right? Where the technology empowers people and improves health for everyone, no matter their background.
Absolutely. Using AI to build a more equitable, accessible, and effective healthcare system that puts people first.
We've covered a lot of ground in this second part of our deep dive. We've really dug into some of those complex challenges, the things to consider when we're bringing AI into healthcare.
We have.
But even with the challenges, there's still this sense of optimism,
Yeah, definitely.
A belief that we can use this technology to create a better future for healthcare.
Absolutely. And in the final part of our discussion, we're going to look at what that future might look like, explore some of the new trends, the innovations that are shaping AI in healthcare, and think about what it all means for the future of medicine and patient care.
So folks, stick with us as we wrap up our deep dive into this amazing and rapidly changing world. We'll be back in a moment to explore what that future holds for AI and open data in healthcare. All right, and we're back. For the last part of our deep dive into AI and open data in healthcare. We've talked about the potential, we've talked about the challenges, and now it's time to look ahead, right?
What about the future?
I like that, looking ahead. It's like gazing into a crystal ball, isn't it? To see what the future might hold.
It is. And from everything we've discussed, it seems pretty clear that AI and open data, they're not just changing things a little bit, they're completely changing the game.
Yeah, I totally agree. It's like rewriting the rule book entirely. And while, predicting the future exactly is impossible, there are definitely some trends emerging that give us a pretty good idea what's coming.
So what are you seeing? Like, what's on the horizon that you're most excited about? What advancements, what innovations?
Well, one thing that I'm really fascinated by is the development of those AI-powered wearable devices.
Okay. Yeah. We're moving way beyond just simple fitness trackers.
Right.
To devices that can like constantly monitor all sorts of health metrics. Everything from heart rate and, sleep patterns to blood glucose levels, even stress indicators.
So think about it. Your smartwatch, it's not just telling you to get up and move around. It's giving your doctor like a live feed of your health data. Right?
Exactly. And that constant stream of data, that can be analyzed by AI algorithms to pick up on tiny changes in a person's health.
Wow.
Maybe even find problems before you even notice any symptoms.
It's like an early warning system for your body.
Exactly, alerting you to potential issues before they become, really serious.
Okay, that's amazing. But what about the people who can't afford the latest gadgets? Will this stuff be available to everyone, or is it just for, a select few?
That's a really important point. And we need to make sure this technology doesn't just make existing inequalities worse. But I do think as these technologies get more advanced, we'll see them become more affordable and accessible.
So maybe one day these AI-powered health monitors will be like as common as smartphones are now.
It's definitely possible. And as more people use them, they'll generate this massive amount of data, which will then fuel, even more powerful AI algorithms. It's this amazing cycle of innovation.
Data leading to better healthcare outcomes. That's a pretty exciting thought. But all this data, it does raise some privacy concerns, doesn't it?
It does, absolutely. As we move towards a world where our health data is constantly being collected and analyzed, privacy and security, those have to be top priorities.
It's a tough balance, right?
Yeah.
We want to use this data to improve healthcare, but we got to do it in a way that respects people's privacy and their right to make choices about their own information.
Exactly. And that's where, strong data governance and ethical guidelines are so crucial. We need to make sure people have control over their own data and that it's used responsibly and transparently.
So it's about finding that middle ground.
Yeah.
Innovation, but also responsibility.
Right. And as AI continues to evolve, I think we'll also see a shift toward more personalized and preventative healthcare. Imagine, your doctor using insights from your genetic data, your real-time health info to create a plan just for you to keep you healthy and prevent disease.
So no more just waiting for something to go wrong.
Yeah.
It's about staying ahead of the curve and staying healthy.
Exactly. And I think this will also give patients more control, because as people have more information about their own health, they can make better decisions about their care.
So it's not just being passive.
No.
You're an active participant in your own healthcare.
Right, exactly. And as AI gets even more advanced, I think we'll see it playing a bigger and bigger role in medical research. Imagine AI algorithms sifting through huge amounts of data to find potential drug targets, predict how effective treatments might be, even design personalized therapies.
It's like having, an army of researchers working 24/7 to advance medical science. And the speed of discovery is just going to keep increasing, right?
It is, yeah. And that could lead to breakthroughs in areas like precision medicine, treatments tailored to your specific genes and lifestyle. We might even see cures for diseases that right now seem impossible to cure.
That's a future worth working towards, a future where AI and open data help us not just, treat disease, but prevent it in the first place.
And that's really what it's all about, using technology to create a world where everyone has a chance to be healthier and happier.
Well, I think this deep dive has given us all a lot to think about. We've explored the present, we've glimpsed into the future of AI and open data in healthcare, and it's clear we're on the edge of a huge transformation.
It really is a transformation that's going to affect every part of healthcare.
Yeah. And as we move forward, it's so important that we keep asking questions, keep talking about these things and work together to make sure that this incredible technology is used responsibly and ethically to benefit everyone.
I couldn't agree more. The future of healthcare, it's in our hands. It's up to us to shape it in a way that reflects our values and our hopes for a healthier and more equitable world.
So as we wrap up our deep dive today, I want to leave our listeners with one last thought. The world of AI and open data in healthcare is constantly changing, and it's up to all of us, to stay informed, to stay engaged, and to stay curious.
Because the future of healthcare, it's not something that just happens to us. It's something we create together.
And on that note, we'll leave you to continue exploring this incredible world. Thanks for joining us on The Deep Dive.